Ultrasound can be used for deep heat. It uses sound waves to penetrate the tissue. And it causes really small vibrations in the fluid within the interstitial space. That vibration causes the tissue to heat up from the inside out, essentially. So it's a deep heat. Heat helps relax muscles, brings blood to the area, kind of flushes nutrients through. Ultrasound can also be used non-thermally, just based on the settings, where it sends pulses of the ultrasound waves, which increases circulation without producing heat. So if someone is really swollen and you don't want to bring a lot of blood to the area, you can use the pulse setting to help jumpstart some healing process, getting fluid moving, nutrients into the area without making the swelling so worse by increasing the heat. Difference between doing an exercise with the arm straight versus the arm bent is it's going to change the lever arm of the muscle working. So if the arm is straight out, the lever arm is going to be much longer between the hand and the shoulder versus having your arm bent with or without resistance. So a straight arm exercise is going to be more challenging to the shoulder. Resistance bands are used primarily for strengthening, having the resistance. Resistance bands are great because they're a progressive resistance, meaning that the longer you stretch them, the more resistance it is. So as the muscle is becoming more efficient, the resistance is getting stronger. It's appropriate to use when you're trying to strengthen. That's not always the goal. Sometimes you want to work range of motion, or you don't want a stronger resistance at the end range, so you don't use it. Angles of your arms and legs when you're using any exercise, using bands or any exercise is always important, because you want some mechanical advantage to your muscles so that they can work more efficiently. And again, just like the lever arm, to change the angle of your joint, it's going to affect the lever arm. It's going to make the exercise harder or easier based on the angle that you're using. When you're using bands, if you're doing a rotation, say at the shoulder, your pivot point is going to be the center of your humerus. You want it to rotate kind of on its long axis, as opposed to people that try to cheat and instead of keeping their shoulder still, they'll want to move with it, and it'll create more torque to the joint that we're not looking for, and it'll kind of tweak which muscles are being isolated. So if we can get them to isolate along the pivot point along the long axis, we're going to isolate the external rotators a lot better. Anytime we're doing exercise, it's all physics, it's all biomechanics. You're looking at joint angles, you want to make sure that patients aren't cheating, because anytime we do an exercise, there's usually a goal of a certain muscle group we're trying to hit. So if they start cheating and they start changing their angles of their hips or of their knees, it recruits different muscles, so the body's trying to compensate to make it easier on the muscles that we're trying to work. So if we can force them into good position, good technique, we're going to target our muscles more appropriately. I mean, so it's every single thing we do. We're hounding on technique and posture to better align the muscles and make them work more efficiently.